What does Candida albicans have in common with diabetic patients? They both love sugar. That's why vulvovaginal candidiasis, I'm sorry for the joke, that's why it's common in diabetic women. It presents with eclatic cottage cheese discharge and also intense vulvular itching. In microscopy, you can see budding yeast and pseudohyphae. And what sets the Candida apart from trichomonas or BV, bacterial vaginosis, is the pH is going to stay really low. It's like 4.3. And so because the lactobacilli are still hanging around, when you see the thick white discharge on an itchy patient with budding yeast, then think of Candida, especially if they're on antibiotics or they have diabetes. So here's our practice question. A 24-year-old sexually active woman presents with thick white vaginal discharge and intensive vulvar itching, and she has recently completed a course of broad-spectrum antibiotics. Pelvic exam reveals erythema of the vulva and also a thick adherent discharge. A wet mount shows budding yeast, and look at this pH, 4.3. So what's the diagnosis? It's going to be vulvovaginal candidiasis. So the antibiotics are going to disrupt that normal flora, like the lactobacilli, and they're going to allow for the overgrowth. And also you see that low pH and pseudohyphae on microscopy. Okay, so that's what you need to know. Why is it not like trick? That's the frothy green stuff, motile. It's greater than 4.5, so not going to be as acidic. Why not gonorrhea? So gonorrhea is going to be that purulent discharge that's not itchy, and it's going to be gram-negative diplococci. Atrophic vaginitis, so that's going to be postmenopausal pale mucosa with a thin discharge. It's not associated with pseudohyphae at all. Hopefully this is helpful. If it was, then like and subscribe. Hopefully my joke there was in good taste. And hopefully you guys have a great day.